Yeah, good afternoon, all of you. Then now JEISS cataract workflow, and I'll be briefly touching on it. Slides move on. Yeah. So this is basically a sponsored talk, so supported by the JEISS for our educational activities to our society. See, coming to the cataract surgery now, earlier few talks we were discussing, cataract surgery now became a refractive cataract surgery. The aim is to get a 6/6 and 6. It requires proper evaluation and then planning and then the workflow. That is mainly the data flow from the pre-op situation to the intra-op situation. And all these, we need a good biometry, data transfer to OR, and then integration during the surgery. This is what we need in the current cataract surgery practices. Then once it's going to refine, then we can aim at, like what Ramurthy was saying, the refractive lens surgery. Coming to the planning, we require a highly predictability in the postoperative refractive outcome. That means the lowest possible prediction error. And all these things should be precise acquisition of the biometric parameters, like what we were discussing, white to white lens thickness and the effective lens position. Using the optimal formula, the data can be transferred after the calculation between the systems. That means from the OPD system to the OR. And then on the OR, then proper alignment of anatomical sites between the sitting position and then the lying position. One can aim a consistent surgical location of the intraocular lens, but over and above this, all what we need is a consistent surgical technique and outcome. And all these were provided at present. There are few companies, mainly two companies. One is Alcon and then the other is by JEISS. JEISS has got the latest IOL Master 800. With all the features of the modern acquisition, and then the IOL precise acquisition of the alignment, and then can be transferred to their Callisto system in the OR that can be used to any of these Lumira series. This we all know the IOL Master 700, how efficient it is, and then how precisely we can calculate with the lowest amount of errors. And along with the biometry, we can digitally acquire all the parameters in the OPD itself, which can be transferred in through their central data source. Then from there we can transfer into the OR through the JEISS forum. So it is attached to the JEISS microscope, where we can pull all the data from the OPD acquisition, and then proper planning can be done. That will suggest us right from incision to capsular access to the implantation access of the toric IOL in such incidences. Even the location of the incision with minimal astigmatism, we can still go ahead with the steep axis surgery, where we can nullify by using the surgeon-induced astigmatism. This is the Callisto system, where you can plan, and it will guide us marklessly to where to locate the incision, and then the sizing of the capsular access and the placement of the intraocular lens if it is a toric lens. So earlier we used to use different machines. One is for calculating the biometry, another is for the digital marker, and then if it is again in the OR, if you don't have that, from the basic biometry and then the manual marking, and then doing the IOL. So now all these can be integrated into a single system. We don't have to shift the patient from one position to another position, and all these. There are several studies which have proved that the IOL rotation is least and the prediction errors are lowest when we use a digital marker when compared with the manual marker. This is how the latest technology of the JEISS is available. To summarize, Now, with one acquisition of the parameters, planning for proper IOL, to have the appropriate anatomical markings on the table for accurate placement of the IOL, that gives us a good visual outcome with least refractive prediction errors, and that gives the entire surgery as the markless surgery. Thank you, sir. Now I invite you all to today's banquet dinner, where we arranged a big screen for the live match transmission also, along with your dinner. Please come and enjoy the dinner. Thank you, sir. It is around 12 kilometers. You can ask for a VUDA Park, VUDA, that means Visakhapatnam Urban Development Authority Park, or the Park Hotel on the beach side. So it's besides the Park Hotel. Yeah, Palm Beach, just besides that. Yeah. Thank you, sir. Thank you very much.